Hi, everybody. My name is Arohi Shah. I am the Associate for Think Neuro Summer 2024 Behavioral Neuropharmacology Group. Today, me and my team are going to be presenting about mechanisms and combined treatment approaches of SSRI and amphetamine type stimulants in treatment-resistant depression. Before we go into the project details, I want to go ahead and talk about my teammates. I have Suad as my co-associate, and I have Azzy, Alam, Sarah, Shaira, Shraddha, and Yuhan as my teammates who would be helping me present this topic today. Let me tell you a little bit about the background of this project. So because we are from a neuropharmacology group and we are focusing on the behavioral aspect, we wanted to focus on mood disorders. And so we decided to work on treatment-resistant depression. Now, there is no clinical definition about this particular disorder, but it is considered that if there is persistent depression involving lingering symptoms, even with treatment with multiple antidepressants that are going on for more than 4 weeks, that is considered treatment-resistant depression. Now, it requires a combination of drug classes or augmentation therapies for mood improvement. And because we are on neuropharmacology side, we wanted to focus on combined drug approaches for this treatment-resistant depression to study the treatment outcomes. We decided to focus on SSRI and amphetamine type stimulants as our categories for these. With this in mind, we had 3 different aims that we wanted to target. The first being the exploration of mechanisms of action for both SSRI and amphetamine type stimulants in treatment of treatment-resistant depression. We also wanted to observe some general trends from the combined use of SSRI and ATS as a potentially effective treatment for the TRD. And we wanted to utilize Web of Science, RStudio, BiblioShiny, and some other references to have robust and credible research. I want to go ahead and mention the identification and screening process for our entire project. We started with 4 keywords. They were SSRI, amphetamine, treatment-resistant depression, and mechanism of action. And using these 4 keywords, we had total of 816 papers that came up from Web of Science. We wanted to narrow this down a little bit, so we used some filters such as review articles, and we wanted to look at recent papers, so we targeted all the review articles after the year 2016, and we ended up with 102 review articles as our result. We used this to generate our analysis of the results. I will go ahead and hand it off to Shraddha so that she can talk about the methods that we used for the Web of Science as well as RStudio.
So as Arohi mentioned, we narrowed it down to 102 papers in our preliminary search. And from there, we decided that there were 100 sources that were eligible for a study. And then also from there, we focused on SSRI and ATS mechanisms and also clinical data trends to narrow it down to 15 review articles. And from there, we generated figures using WOS, CSV files, RStudio, and BiblioShiny, and we did it twice. We did it for the top 100 papers, and we also did it for the top 15 papers. And we use this to compare the trends between the most frequent keywords and also journals with multiple top-cited papers on treatment-resistant depression. And now I'm going to hand it over to Yuhan to talk about the results that we generated.
Yeah, so from the results generated, from the top 100 cited articles, we were able to narrow that down to top 15 in the respective journals to get more robust and reliable results. And as we can see from figure 3, the top journals change from Curious Journal of Medical Science and the following with articles range from 2 articles to 5 articles per journal to the following to psychopharmacology and more. And this helped us to get more concise articles with the focus on SSRI and amphetamine-based data. And this just provided us with more credibility of results with a sense of quality over quantity. And next, we have Alam for the results of the most frequent keywords.
So, when taking a look at Figure 5, keywords most frequently mentioned within the top 100 cited papers, you'll see that ketamine is at the top, and other irrelevant words such as stimulation and disorders appear frequently. When you look at the top 15 cited papers, you'll see that um, ketamine isn't there, and keywords such as SSRI, amphetamine, and stimulants are prevalent and frequently used most. This allows us to get credible articles that allow us to see um, more relevant keywords and find allows us to find even more articles that are focused on research questions and our research question and aim. Now handing it off to Adzi with the applications used.
So we applied RStudio Web of Science in BiblioShiny in multiple ways. So one of the ways we have here is to explore potentials and mechanisms of action of different drugs in treatment of mood disorders, specifically treatment-resistant depression here. And then we go to explore current trends in clinical trials. Lastly, we also wanted to take a look at adverse effects from combined treatment approaches in behavioral neuropharmacology, specifically SSRIs and ATS. So, keeping this in mind, I will now hand it over to Shaira to talk about the mechanism of action of SSRI and ATS that we found from the papers collected based on these aims.
So, as far as mechanisms, SSRIs, which stands for selective serotonin reuptake inhibitors, block serotonin reuptake transporters, which prevent reabsorption of the serotonin. This allows for the presynaptic neuron to release serotonin into the synaptic cleft, and by blocking reuptake, SSRIs are able to gradually increase the amount of serotonin available. This helps to slowly alleviate symptoms of depression and are typically used for long-term treatment. However, because of the gradual effectiveness, it is recommended that SSRIs are used alongside ATS, which has more immediate effects. And now Suad will talk more about ATS.
ATS, also known as amphetamine-type stimulant, work by inhibiting the reuptake and stimulating the release of monoamines, which include dopamine and norepinephrine. Serotonin and serotonin. This dual action causes sudden increase in the levels of these neurotransmitters in the synaptic cleft. The result is a rapid elevation of mood, energy, and focus, providing an immediate effect. However, these drugs can also lead to dependency issues, thus ATS are not suitable for long-term use and are often combined with SSRIs to provide immediate relief. Now that we have explored the mechanism of action of SSRIs and ATS, Sarah will explain clinical data to understand the general trends.
As shown by the general trends in clinical data, selective serotonin reuptake inhibitors and amphetamine-based treatments are proven to be effective in treating treatment-resistant depression. In addition, it is proven that it is up to 20 to 60% more effective when using a combination of the two treatments rather than using just one. And this study involved many participants from a diverse and large population pool who all exhibited similar results. Many of the people in the studies were adults, while there are also some studies that included adolescents. And figure 9 shows the patient population by study, so the number of patients who participated in each of main studies. And this gives the study a more broader perspective. Figure 10 also goes on to prove the study by showing the improvement rates that range from 20 to 50%. And all of these different studies show some sort of improvement in mood. However, it is also important to consider the side effects of using this type of treatment. So in figure 11, there's a comparison between the total percentage of participants, which is 100, to the percentage that experience side effects. These side effects include insomnia and increased heart rates, and they ranged from 20 to 30% of the total participants. This is why the augmentation of ATS with SSRI is not really favored for long-term treatment, although it is continuing to be used. And I will pass it on to Azzy for the conclusion portion.
So to conclude our research, there are two main points to make related to our research objective. So firstly, the authors we found in the top 100 cited papers provide a very well-rounded perspective on research in this area. It is important to note that some journals feature more credible and innovative work than others, especially those that contain the top 15 cited papers in our refined search results that we sourced out using Web of Science, BiblioShiny, RStudio, and other tools mentioned earlier. Secondly, the diversity of papers found shows research potential for future studies in behavioral neuropharmacology and improved drug treatments on mood disorders. However, limited research data such as sample size and trial numbers could affect research trends by a lot. Lastly, we would like to thank Neuro for giving us the opportunity to present here at the Summer 2024 internship. We would also like to thank you for viewing our presentation. Our references are available here on this slide. Thank you for watching, and I hope you enjoyed.